thing that we talked about as far as in health reform, I'm still for health reform. You can't sustain what we have. Now, once you saw the 2000 bills, or once what I saw was dissected out that gigantic piece of legislation, I don't know how a lot of that stuff got in there. Didn't make any sense to me whatsoever. But the principle that I understand that Democrats and Republicans, a lot of them agreed on, which was the pre-existing conditions and all the things we've talked about, that should have been the nucleus of a pretty good piece of legislation. Did they go too far? Did they overreach? I believe yes. And I believe that can be. Now, people say, well, I didn't change my position. I don't think if you had a pre-existing condition, you shouldn't be able to buy insurance. I don't believe your child's born into this world with a condition that he or she shouldn't be taken care of. I don't believe that if we can close that donut hole, that we should do it. I believe we should. So I believe that once you set your priorities in small businesses, I've said this all along. I was working before the 2008 election of figuring out how I could, in West Virginia, come to you and say, we have the ability to cover every working person in our state. If you're willing to get up in the morning and go to work, we're going to have affordable, accessible insurance to you. Because they're the most vulnerable part of our society. If you are old enough, you have the Medicare. If you're poor enough, you have Medicaid or access to it. If you're a child, you have the CHIPS. And if you're a criminal, you have the courts mandate you get insurance or get coverage. But working people are the ones left most vulnerable in every society, in every state. They're the ones that are one illness away from bankruptcy. That's ridiculous. The people we're asking to carry the load every day to make this economy run, and we leave them that vulnerable, and we spend more money than anybody on earth for health care, and we rank 37th in the world of health. I just think we can do better. So yeah, I agree with health reform. Do I agree with everything in the package they have? No. Once I saw it, Penny, no. I didn't see it. I agree with the principles of moving the ball forward. Let's go back and fix it. And I hope we have enough good people that want to do that. Well, I've always tried to fix things. Tell me what you don't like. And if you're telling me there's 6 or 7 or 8 items you like, why would you throw it all out and start over? It doesn't make any sense to me whatsoever. And I would think that there would be, unless they've just gotten themselves into a political situation where they've made a promise and a commitment they can't. I hope not. I would hope that common sense would prevail. And that's where the litmus test is it good for America? And you would like to think that if you look at it and you try to fix things. I've said this, we come back every year upstairs. We have a legislative session every year. That session is held because we go back and review. It's not because we have brand new ideas every year, but we're trying to make sure what we've done, we have a year to look at it. Can you fix it? If it needs to be repaired, can you make it better? You sure should try. And I would hope that's the approach they take. That's what I'm going to take. From what I saw in the bill, as far as, yeah. Well, the mandates to a certain extent were overreaching as far as who we are. Okay, the 1099 section. And I think they've all agreed that should be taken out, Democrats and Republicans. That might be the first compromise you have to try to fix it. If you can fix that and take it out and we agree, why would you repeal, take the sections out that basically make no sense? I would just hope there would be enough good people that want to do that.